Candice Langford, pelvic and sexual health physiotherapist, and this is the Nurture Pod. We are talking pee, poo, pleasure, pain, periods, pregnancy, postpartum, peri, and postmenopause. All the P's, all supposedly taboo, yet essential to our holistic health and well-being. We are shining a light on each and every one of these, both confidently and comfortably. Let's get curious. Why did nobody tell me? This is something that I have been asked time and time again by patients, and most specifically by those individuals that are in their pregnancy and postpartum phases of life. Whether it's trying to conceive, actively pregnant, postpartum in the early phases, weeks, days, or going way through into 10, 15, 20, 40 years later. Why did nobody tell me? This is something that we are going to dig into with today's guest, Kirsty Nel. So Kirsty Nel is a physiotherapist that qualified in 2006. In 2012, she completed her Women's and Pelvic Health Special Interest modules with the South African Society of Physiotherapy in Cape Town, where she did both her written and practical exams as well as a case study. In 2015, she went to London to complete her foundation courses in Western Medical Acupuncture. When she returned, she worked for and was mentored by Phyllis Berger in the pain management and infertility acupuncture clinic. In 2019, she opened her own practice to spread her own wings into a full-on women's and pelvic health focused treatment practice. So this coincided, funny enough, with her conceiving herself. And it was quite unexpected, if I so do understand. Her little one was born in January 2020, shortly after COVID hit South Africa, and we soon went into our first phase of lockdown. She had to adapt the way she treated and consulted with her patients, and in this, she developed her Instagram platform and her page and webinars that she has run, and I'm sure you will come across on her page. And this has just gone from strength to strength, and Kirsty is just the most amazing voice within this field, and for her patients and potential patients alike. So seeing this gap in awareness for mums and for women, she decided to launch her platform called Andher Women's Wellness. This site is aimed to be a space to empower and to support women in various stages of life and health with information. This site aims to be a space to empower and support women in various stages of life and health with information, products, and materials to help their specific needs. The first products are almost ready for launch, and I'm so excited to see and hear what they are. And they'll hopefully be live by the end of the year, so you can watch the space to engage with Kirsty Nel in that platform and her women's wellness. So nonetheless, let's get started and chat to Kirsty herself. But first, one of the most common questions that comes my way is how to have better and more satisfying sex. Although this is multifactorial, I so value the potential of erotic audio content to pique mind and body arousal. The audio app Guided by Glow aims to do just that. Their guided sexual meditation journeys gives you the space to slow down, relax, and connect you to your senses, your creativity, and of course, nurture your relationship to pleasure as you drop deeply inside the feeling body. Listen until the end of today's episode for a special gift from Guided by Glow. Okay, Kirsty, thank you so much for being here today. I have this really important, thank you, love. I have this really important question that I want to ask you, and not just for my patients, the people that I've interacted and engaged with over the years, but I'm pretty sure it's for every single new parent out there that's just wanting to know, why did no one tell me? Tell us, Kirsty.
No, you're absolutely right, Cans. It is a big question that comes up for a lot of moms, not just first-time moms, second-time moms. It's this new normal that they find, and kind of feeling like the rug's been pulled out from under their feet a little bit, and they're dealing with a lot of things that weren't really exposed to them or made known to them in the pregnancy and leading up to the birth, and about the postpartum phase. And I see it so much in practice myself. Because a lot of my practice works around antenatal and postpartum treatment with these women. It is very common for them. The first thing they walk through the door and say is, I wish I had known, or why did nobody
Yeah.
tell me this was going to happen? And I think a lot of it actually stems through women's health in general. Is women are very poorly empowered about their health. They're not given access to a lot of information. A lot of things are very stereotyped in terms of culture and social circumstances. And some of these underlying issues can actually be there prior to pregnancy. It's just deemed as normal, or they don't know what they're really experiencing. Maybe it'll just go away, or just too shy to bring it up. And then during our postpartum or childbearing years and postpartum phase, we really see some of the stresses that come into the pelvic floor in that way, and what can happen, and the results of that. So what I really focus on in my work is to help women feel so much more empowered about their bodies, understand what's going on during pregnancy, and almost try, being a physio yourself, you also understand this is the stuff we learn at varsity, and it's kind of all put together in theory. But for the average person, and even myself, when I was pregnant and having kids, when you actually the patient, it can be quite a different scenario. And just to have someone guide you and help you to understand your body, what you're feeling, what the process is, what's normal, even though it's common, how do you deal with it? And then, most importantly, what I really focus on is how do we plan for that postpartum phase? Because everything in pregnancy, especially a first time pregnancy, is so based around having the baby and the excitement and choosing the name and choosing the clothes and the nursery. And mommy, everybody fusses around mommy while she's pregnant. And then baby arrives and mom kind of gets left out in the cold a little bit, and she has a
Yeah.
lot of needs and needs a lot of help, and has a lot of questions. And um, you know there just isn't that support network, and it leads women to feel very, very alone, very scared, sometimes even ashamed of their body, not sure how to process what they've been through and how to move forward. So I definitely try bring that in quite a lot in pregnancy treatments, apart from treating the pain and the discomfort, and doing birth prep, talking a lot about once baby arrives, what are some of the challenges that mom can experience. Sorry about that. That's life with kids. That's one thing. That's a big one to know. You'll be interrupted all the time.
That's totally fine. It's totally fine.
There we
Carry
go.
on,
Case
girl.
in point, right there. So a lot of my practice is prepping moms and educating them so that once baby has arrived, they know the steps of who is there to support them afterwards. Because generally, with a gynae-led birth, and there are fantastic gynaes out there, and our doctors are wonderful, but gynaes birth and get you through that, and then that's pretty much where your relationship will end with your doctor. They'll have a 6-week checkup with you to just see, especially if you had a Caesar, is everything healed? Is that all okay? If you've
Yeah.
had a vaginal delivery, just to check in that everything's also healing and fine. But their job is pretty much done from the birth onwards. And that's where the gap comes in for moms who are experiencing pain, dysfunction, that who's there to help them, what do they do
Yeah.
about it, and the stigma that, well, you've birthed a baby and now that's how your life is going to be, this is what your body's been through, accept it. That's
Yeah.
the message that's been passed down, and through no fault of their own, from our generations of moms and women before us. But things are changing, and women are wanting more information. They're wanting to know about their bodies. They're wanting to know what options they have, because they're not settling for that this is just how it is. And
Yes.
that's why there's such a great platform now to, like what you're creating here, and through physiotherapy, to actually, expose them to that and explain things to them, and help them more and be more supportive.
Yeah.
And I think a lot of women are actually starting to benefit from that more and more and more. And I'm seeing that in practice, that by word of mouth, I'm getting more referrals through by word of mouth, and in between patients and friends, than any of the doctors and
Yes.
midwives and medical professionals. because
Yeah.
women are not talking about that. And when things come up, someone will say, oh, well, have you tried a physiotherapist? Have you tried a physiotherapist with a special interest in women's health? Because I did,
Yeah.
and this is how she helped me. And the
Yes.
conversation goes from there. And also moving
I
away
love.
from the shame of actually talking about the fact that I've had a baby and my bladder, I can't hold urine anymore, or
Yeah.
my relationship with my husband has changed so much, and sex is just not the same. I don't feel the same. When looking at other couples and thinking, gosh, everybody else looks amazing and just having the time of their lives, and what a blissful situation they're in. And I'm the only one
Oh,
with this problem. What's wrong with me?
yeah.
Women are talking about that more. And I definitely, um, you know, in terms of women's health, don't hold back on that when I see patients, and explain that.
Yeah.
And you don't want to scare your patients. You don't want a pregnant mom is so excited and so happy, and there's so many lovely things to look forward to. So I don't mean I'm like the doom and gloom sort of coming in and saying, oh, incontinence and tears, and what are
Yeah.
you going to do about this
Yeah.
and what are you going to do about that? But trying to just empower them in a gentle, supportive way to say, look, experiencing this, or come, this is why you should come and have a physiotherapy checkup at 6 weeks. And it's a common analogy, and one that I love to use. But you know I compare pregnancy and birth to prepping for a sports event or a big marathon, because it's the same kind of tools you're using. You maintaining certain fitness, you stretching certain muscles, you mentally getting ready for this big event that's going to take place. How are you going to get through that, and then how your recovery is going to be on the other side? And even if that's the same thing with birth and pregnancy. And as you get to the other side, if you've sustained any injuries, you would see a medical professional to help you with that. You'd have some rehabilitation. You'd have a team in place to guide you through. So it's no different for women having babies. It's the same. It's the biggest endurance event of our lives, actually. 9 months plus the extra bits after that, and then the recovery. Um,
Yeah.
and again, women come in and say, gosh, why did I never hear of a physio like you? Why don't they talk about you more? Why don't the doctors tell us you're around? Or and
Yeah.
that's the thing.
Yeah.
So we trying, as I know you're in the same boat, we trying step by step to get out there and
Yeah.
get our voices heard, and hopefully with more empowering our patients, that will be the voice that speaks, and passing it on to
Yeah.
now going forward daughters, and that a better
Exactly.
education, better empowerment about our own health.
Yes, so I absolutely agree, and I'm just loving all the words that you are using. I really focus about on the choice of words, and I think we share a lot. There's a lot of commonality in the way in which we choose to speak to people, and I can just hear it coming through. And one of those things is the fact that we're in this transition phase, and it's not to blame the new parent. It's not to blame our grandparents. It's not to blame the doctors that we haven't had this access to care. It's just that we're in this transition phase, and this is almost new. Our perspective on pelvic health, on women's health, on gendered health is changing, and it's beautiful, and it's something that we just need to embrace and allow
Mm,
it to be. And instead of focusing our time on it's the fault of XYZ as to why we haven't had this care, rather it's here, it's now, we're advocating for ourselves. And that's what I'm hearing you saying with your patients, and the word of mouth referrals is that there's so much advocating going on where
mm,
people are saying, I deserve this, you deserve this, and this is available out there for you. Common,
absolutely,
not normal, and there's so much that can be done.
absolutely.
And yeah, and one other thing that I'm really kind of feeling come through from what you're saying is that a lot of the reason as to why we've had this lack of access to care is because of the fear and the shame that's been around pregnancy, incontinence, constipation, prolapse, tears, etc. Just the word vagina and sex in
Mm,
general, is that there's been this lack of information. And I always say, you don't know what you don't know, for starters, so you can't blame yourself if no one's ever told you and you didn't know these things existed. But
exactly.
also we can conquer fear with information, and that's what both you and I are really doing. We're throwing information at people just so that they can, slowly but surely educate themselves, advocate for themselves, reach out for help when they realize, oh, okay, it's
Yeah.
okay to use lube. It's you
Yes,
know,
exactly.
penetrative pain is common, not normal. I don't have to just put up this. I can advocate for my pleasure. I can advocate for my comprehensive pelvic, bowel, urinary health. But before I go on a tangent about the transition phase that we are in, this beautiful phase, tell us, Kirsty, just help us to really understand the role of pelvic health physiotherapy in this transition, now talking about pregnancy going postpartum. I know that your voice in this field is so valuable and people just need to hear it.
So it starts, the common place that patients start with me if they're going on the full journey is to come in when they're pregnant. And with pregnancy, depending on the stage or trimester, there might be some musculoskeletal pain, and that's usually why patients reach out. And the first thing to do is to educate women on, as a physiotherapist, that's what we do. We know about muscles, we know about joints, we know about body function, and we know about how that works in synergy all together. And our biggest role as physiotherapists in general, for anyone, and I often say to patients first up, so have you ever been to a physio before? And they will say, oh, yeah, I have. And I say, what for? And, oh, well, I had this neck pain. I say, well, this is pretty much the same thing that you're coming in for, except we've got a slightly different take on it. So I explain to them, what's happening with their pregnant body, how their joints are changing, how their body is trying to, in a core factor, support their daily function as a person, but now also support a growing baby inside that's putting an additional strain on the body. And that's where certain functions, like with the pelvic floor, battle to cope in both circumstances, and why certain things, like maybe a bit of leaking or not being able to hold any wind or having this lightning crotch pubic pain occur. And already just explaining that and helping them to understand, and also explaining that this is not like a regular physio session where you're going to come in and the pain is going to be eased up. We'll get some symptom changes, but you're in a transient phase of your body adapting to a certain point. The pain's going to come and go. It depends how baby's sitting in your tummy. If baby's lingering over to one side, you're going to be compensating more on the other side of the pelvis. So we often find that, and especially interestingly postpartum, with one-sided pain, that when you chat to mom about, if I hadn't seen her when she was pregnant, about how she experienced her pregnancy, there's obvious signs of what was going on. And that just sheds light on the situation and helps patients to understand their bodies a little bit more. And then prepping up to the birth, whether a woman is, wanting to have a vaginal delivery, or they are now thinking more on the C-section side. I hold no judgment. I had 2 C-sections. I went into labor with my first, but it was my choice to have my C-sections. I don't regret that at all, but I educate patients on both. I think it's important to understand both, especially if you are going for wanting a vaginal delivery. It's very important to just understand the role of the C-section and why it's there, and that it's not this big misnomer, this big scary C-section. It's almost like a swear word that you can't say around pregnant people, because it's just not something that's done. It's and then carrying that failure and that guilt because of that choice is absolute nonsense. So I explain it in very basic, normal, easy terms for patients to understand, and we do a lot of birth prep, and then in that phase, having the role of, as a physio, to explain to patients, now you're seeing these changes in your body. Now, once you've had your baby, this is where we're going to need to rehabilitate you, because through a vaginal delivery, you may have had an episiotomy or a tear. You may have had some perineal trauma, and that needs to be rehabilitated. Or you had your Caesar and your abdominals have been separated, you have a wound, you need to have rehabilitation to get back to you again. And you're allowed to get back to you. It's not all about taking care of a baby. And like I say, mom gets kind of shoved out a bit, You're still a person there. And I always say to moms, the best you can be for your baby is being the best for yourself, because everybody else is going to just benefit from that. So, you have to keep a tab on yourself too. So physio has a major role in terms of not only physically helping with pain and discomfort and strapping and positions and advice and exercise and all of that in pregnancy, but then also on the information front, helping patients understand that. Then moving through to the postpartum phase, where we help on the rehabilitation side. Just again, another analogy, like if you'd had a hip replacement, you would have rehabilitational physiotherapy to learn how to weight bear on your hip again, no matter what age you are, for certain activities you want to get back to. I mean, that's what we do at Varsity. You learn how to mobilize patients out of bed post-surgical, and what to give them and what to tell them, and stages they can go through, and what not to do initially, and now you can do this. And it's exactly the same thing postpartum. We're just managing it from a slightly different angle. And most of my patients that I see are coming in at that phase where they've had babies, or they've had a pregnancy, and now they want to have postpartum rehabilitation. And so again, our first treatment is very much, I call it the meet and greet with your pelvic floor, because that's what it is. It's an introduction of, hello, so and so, meet your pelvic floor. Pelvic floor, meet the person you're in. And this is
Yeah.
how we can, it's about building that communication channel. And I just see it every time, and I'm sure you do too, when patients walk out or they finish with their treatment, just how much more they enlightened they are. And they all comment about how interesting it was, and they didn't know that, and they can't believe that that's what it's supposed to do. And it's feeling different already, and they're feeling so positive. And there's just this kind of like, from a very kind of, if especially if it's been a traumatic and difficult road they've been on, to now suddenly having this kind of spring in their step, because there's now this new knowledge that they know. And
Yeah.
they've, internal exam is an important part of that, because as I often say to patients, and I can't use you an example because I know you know how to do it, but I often sit with patients and say, okay, do a Kegel for me. And then they look at me and I say, are you doing your Kegel? And they say, yes. And I say, okay, how did it feel? And they're like, I think it felt fine. I'm like, okay, well, then that's a Kegel then. I said, that's not how we can do the treatment, because you and I both don't know if you did that Kegel or you didn't, or what it was like, or what the muscle did. And again, you wouldn't go see a regular physio and not have them, touch your neck and find the tight spots in that, and just look at you and say, oh, okay, well, can you turn your head? Can you do this?
Yeah.
Okay, well, then you're all right. You actually have to get some hands-on biofeedback going. And that's, again, where I try and explain that to patients, to not, to have an internal exam can be very stressful. I've had myself, and it's not, in the thought of it is
Mm.
not a very pleasant one. But once they've just got that knowledge, but understand why it's going on, explain to them what the pelvic floor is all about. Education, education, education. It just makes it so much easier. And then they're actually so enthusiastic for their follow-up treatments after that, because now it's almost exciting to come in and take your panties off and have that internal exam done, because it just makes them feel
Yes.
so connected and so empowered in their body. And then finally building onto
Absolutely
that with
agree.
abdominal rehabilitation. um, you know how are we going to get you back to exercise? What is it that you would like to be doing? Do you want to be running? Do you want to be going back to gym? Do you want to just be walking? Do you want to just feel like you have control of your abdomen
Mm.
again? You're not too phased about exercises. What are the goals of the
Yes.
patient? And then working through a
Yes,
rehab
goals.
program for that.
Yes. Okay. Amazing. So it really sounds like, what you've gone through with us is the fact that there's so much value in getting to know yourself, your body, what's happening, how you feeling, and understanding this transition, and not just in the postpartum phase or the late pregnancy phase. It's so important to really get to know yourself and set your goals, your
Mm,
smart goals, right
absolutely.
from antenatal throughout your pregnancy, going into that prep for delivery, and then after that going into this postpartum recovery rehabilitation, and setting goals again, and acknowledging that those goals are going to change, and it's okay for them to change.
Yeah,
It's normal for them
absolutely.
to be different goals through pregnancy. Like, for example, if we just look at one thing being exercise, um, it's going to be different through your first, second, third trimester, and then going into this postpartum phase, and working with someone that has an invested interest in your holistic
Absolutely.
well-being
And if
throughout
that goal
this
changes, or
transition.
if an outcome isn't met favorably, that you know that person is there, your physio is there to adapt and adjust, and
Yes.
will just change the line of course of action. And you've got
Yes.
that person to support you through that. So it's, yeah,
Yeah.
it's very, very important.
Yeah. So I mean, our question in the beginning was, why did no one tell me? Why wasn't I informed of this? And it's multifactorial. It's the fact that we in this transition phase. It wasn't the norm in the past. Pelvic health physiotherapy is relatively new, but over time we are slowly but surely obtaining the information to advocate for ourselves, and
Mm,
realizing that it is okay to intervene, and we don't need to be masters of everything. We can reach out to pelvic health practitioners and say, oh, planning on trying to conceive, how can I best serve myself, my body, my baby as I go into this phase of life, and so it follows throughout the pregnancy and the postpartum period. So
And I've had a lot of women reach out for that to say, I'm thinking of having a baby. I'd like to fall pregnant. Can I come and have a pelvic floor assessment? And that's so great.
yes,
That's
yeah,
amazing because then you've got the baseline information. And
yes,
it's just so wonderful when patients do that to just, they're going to start this journey and they want to just like, I want to train for marathons. That's what I want to do now. So yeah, okay, let me go see a nutritionist, let me get a trainer, let me get a physio. I'm getting my team in place. I'm telling my family you're going to support me and I'm going to run a marathon. That's what I want to do. It's exactly the same thing. You reach
yeah,
out to the people who are going to be your team. And that's another thing I promote a lot in my treatments is who is your team? Who is your birth team? What are their roles? Why are they there? Because I think there's a lot of misunderstanding and also misconceptions and stigmas attached to gynaes versus midwives versus doulas. What are they all about? How do they play a role? They're each so important. They've each got such value, and understand your choices there when you choose your birth team as to how you want to have your support go through.
divine. Oh, you know what, Kirsty, I think it's so beautiful to hear you speak. And like I said in the beginning, I really feel as though we share the same sentiment with regards to like holding a space for your clientele in the
Mm.
physiotherapy realm, no matter where they're coming from and what facets of their lives need that little bit of help or a little bit of education. Um, and it's just really lovely to hear you speak. I mean, I think since we first met, not that we've ever
Yes,
met in person,
absolutely. Yes, yeah.
we just
This
kind of
place has been
feel
in the
that we've
box.
got this, yeah. Yeah, so it's really lovely to hear you speak, and I really do value it. And I'm
Thank
just going
you.
to kind of wrap up this little bit of our interview now, and I'm just going to ask you, is there any points that you want to just bring home to the listeners so that they really feel okay? I understand this now. I feel I've got a better grip on it. And then you can tell us if there's anything new coming up for you, and what's happening in your social space, and how people can reach you.
Thank you. Yeah. So I think to sum it all up, if you are planning on having a baby, or if there's anything, my practice has kind of fallen into the pregnancy postpartum kind of zone. But women's health is a span of our decades of our lives, which have various health things that come up, health issues that come up at various stages. And I think as a woman, if you are feeling uncomfortable, if you have pain, if you don't feel you're getting the answers that you want, if you're experiencing certain symptoms, to reach out to a physiotherapist. And it has to be a physio that has a special interest in women's health. It's kind of like a pediatric, someone who's into peds or someone who's into neuro or into sports. It's just someone who's done additional courses and training more specifically within the realm of the pelvic floor, and has more sort of knowledge and baseline sort of techniques to offer you. So definitely to reach out, and if you are pregnant, and if you have just had a baby, and there is something that's worrying you, if you're not sure, if you're feeling a little bit sort of just unsure about symptoms or weak, or there's pain, again, reach out to a physio, get in touch, take that step and learn about your body and empower yourself to move forward.
Yeah.
So having been pregnant myself, there was a lot of things that I also found very new, and I wish there'd been certain things to help me. And I see it a lot with the moms coming through my practice. And so, as part of a little sort of business that I've started, so my practice is Endher Physiotherapy. And my website, which has just been launched, which I'm finally very excited about, is
Well done.
www.endherphysio.co.za. And a sort of branch off of that is a business that I've started. It will be launched soon. Is Andher Women's Wellness, And this is going to be a platform that includes a variety of products, information, courses. I mean, the sky's the limit of where this can go, but an online platform that women can access, and resources to lists of people that can help them in terms of physios, medical doctors, whoever. It's a baby at the moment itself, and it'll grow. But this will be something that I would like to be a common thing said, that if, someone's battling, like in a friendship group, saying, oh, well, I've had this problem with sex since I had a baby, for another mom say, oh, you should go on to Andher Women's Wellness and reach out to one of the therapists there, or get in touch with so-and-so, or there's products there that can help you. So we will be hopefully launching that soon. The baseline products are very pregnancy and postpartum based, because that's at the moment where I'm seeing a lot of the need. So we are going to be having our little ranges for postpartum vaginal birth care. We've got a lovely C-section product that's going to be coming out for C-section scar support and pain management. And also breastfeeding, some lovely things, easy peasy for cracked nipples, engorgement, blocked ducts. So very, very excited. I've got a lot of collaborators coming on board, other therapists who have things that we want to bring in. So it's going to be a very exciting online platform. And I'm looking forward to launching that hopefully very soon. We're still just putting the final finishing touches on some of the products that we actually have stuff to launch, but we will get there soon. And if you follow my Instagram account, which is Endher Physiotherapy, there'll be more information about that, about my practice. Even just to, often I get patients reaching out from all over to say, I don't live in Johannesburg, but I really would like to see a physio. So do you have someone you could recommend or refer to, even on an international scale? And if you're listening to this and you need help, then, get in touch with Candice, get in touch with myself. Sometimes it's just a friendly chat about symptoms, what's going on, explaining that a little bit first before someone then takes the next step to actually come for treatment. So if that's you, if you need some guidance, then, take the plunge and reach out. We're here to support you, and it's never too late to heal. Someone listening to this might have had a baby 10 years ago. That's okay. It's never too late to love your body and to heal and to recover and to rehabilitate. So take that moment now and make that step.
Divine. Thank you so much, Kirsty. I am 100% certain that that exact scenario that you've just mentioned is going to happen, that women are going to say, oh, have you seen this Andher and websites, and there's going to be amazing content on there for new parents to really engage with and learn from. I can just see it happening. So congratulations on
Thank you very much. Yeah, I'm very excited
upcoming
about it. It's been
launch.
a long time coming, but we're almost there. So watch this space.
Well done. Okay, well, I look forward to hearing more about it. Thank you so much for your precious time and for advocating for comprehensive care and well-being. Oh, it's absolute pleasure.
Well done to you too for creating these platforms for people to speak, because it's important too. So thank you very much.
Thank you, Kirsty. Have a lovely afternoon, and thank you once again.
I'll chat to you soon. Bye.
Well, NurturePod listeners, until next time, please review and subscribe, and as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for 20% discount on all pelvic and sexual health courses. And now, let's indulge in a gift from Guided by Glow, whose mission it is to create a transformational practice of awakening your sensual feeling body, igniting your imagination, and cultivating a positive and thriving sexual relationship with yourself. Try today and take $20 off your annual membership using promo code NURTURE. Go to guidedbyglow.com or find it in the App Store.